Most people over 60 think their back pain is worst at night, but for many, the most dangerous moment is actually the first 10 to 15 minutes after getting out of bed, when the spine is stiff, the discs are swollen with fluid, and one wrong bend can light everything up. This video is about turning those first fragile minutes into a quiet, protective morning routine that helps your back feel safer all day using gentle movements you can do in bed or on a chair. You might recognize this pattern. You go to bed feeling not too bad, maybe a little stiff from the day. You sleep, you lie still for hours. Then in the morning, the first time you roll, sit up, or bend to grab your slippers, your lower back grabs, aches, or feels like it might go out. There is a simple reason for this that has nothing to do with being weak or doing something wrong. When you lie down at night, the pressure on your spine is different than when you are standing. Your intervertebral discs, the soft cushions between the bones of your spine, slowly draw in fluid as part of their natural repair process. By morning, they are slightly plumped up, which is good for cushioning, but it also means they are under more pressure and less tolerant of sudden, heavy bending. At the same time, the muscles and ligaments around your spine have been mostly resting. They are not warm. They are not ready to catch and support you through a quick twist or a deep forward bend. So when you roll out of bed, bend hard to make the bed, or twist quickly to reach for something on the floor, the load on the discs and ligaments can spike. Some studies suggest that bending stresses on the lumbar spine can be significantly higher first thing in the morning, especially with deep flexion. That is why the first rule for a back-friendly morning after 60 is simple. Do not ask your spine to do its hardest jobs when it has just woken up. Give it a few minutes of gentle, guided movement to wake up the joints, warm the muscles, and let some of that pressure spread out more evenly. My name is Dr. Robert Ellis. For more than 20 years working with older adults in geriatrics, morning back pain has been one of the most common complaints. What has been seen over and over is that a simple, consistent routine, done in bed or on a sturdy chair, can change the whole tone of the day. Patients hurt less getting dressed, feel less afraid to move, and report fewer bad back days, not because they became athletes, but because they stopped ambushing their spine in the first 10 minutes of the morning. You have probably been given many messages about your morning pain. Your mattress is the problem. You just slept wrong. Take a pill as soon as you wake up. While mattress and sleep position do matter, they are only pieces of the puzzle. The deeper issue is how your spine and its supporting muscles transition from hours of rest to the demands of your day. There is a systemic enemy at work here, and it is not your age. It is the habit of rushing and folding your spine sharply the instant your feet hit the floor. Modern life encourages speed. Get up, check your phone, bend to feed the pet, lean over the sink, make the bed. All of this happens while your spine is still in its night mode. Disc pressure high, muscles cold, ligaments stiff. On top of that, our culture often sees stretching or gentle mobility as something extra, something you do only if you have a lot of time or if you are into fitness. Very few people are taught that after 60, a careful morning warm-up for the spine is as basic as brushing your teeth. The system gives you pills, creams, and sometimes injections, but almost no one gives you a simple, step-by-step morning routine that feels doable on a tired day. So every morning, many older adults repeat the same pattern. Wake up stiff, move fast, flare the pain. Spend the rest of the day guarding every step and bend, not because they are careless, but because no one explained what is really happening in those first few minutes. Underneath this pattern is a hidden condition that deserves a clear name: morning spinal vulnerability. It is not a formal diagnosis you will see on a scan, but it is very real. After 60, your discs have less flexibility and may lose some hydration and height over time, which makes morning stiffness more noticeable. Overnight, fluid shifts and disc rehydration change the way your spine handles load. First thing in the morning, those tissues can be especially sensitive to bending and twisting, especially if you already have arthritis, disc issues, or a history of back pain. This vulnerability also shows up in your nervous system. If you have had back pain for years, your brain has learned to expect danger from certain movements. Morning stiffness becomes a loud alarm. You roll or sit up, feel a sharp pull, and your whole body tightens in fear. The result is even more muscle guarding, more stiffness, and a cycle that repeats day after day. The encouraging truth is that morning vulnerability is not fixed. It can be reduced. By giving your back a predictable, gentle sequence of breathing and movement before you ask it to do the harder tasks, you can calm those alarms, warm the tissues, and lower the risk of that first painful jolt. This is not theory only. It matches what physiotherapists, spine specialists, and many older adults report when they add a short morning routine to their day. Over 2 decades in geriatrics, many seniors have walked into the clinic saying the same thing. My back is worst in the morning. Once I move for a while, it eases up. What has been seen is that those who commit to a 5 to 10 minute morning routine, not aggressive exercise, but careful, guided movement, often notice that their warm-up period shortens, their fear of bending decreases, and their overall pain is more manageable. This video will not promise miracles. It will not tell you that one stretch will cure decades of back pain, but it will give you a realistic morning plan, a series of simple moves you can do on your bed or on a chair, in your pajamas, in less time than it takes to scroll through the morning news. The focus will be on breathing, gentle spinal motion, and waking up the muscles that protect your back so that when you do stand up and start your day, your spine is not caught by surprise. In a moment, a 3-step routine will be laid out, from the lowest impact, easiest movements to slightly more active ones, all designed for people over 60 with back pain. You will hear why each step works inside your body, how it connects with what is known about morning stiffness and spinal mechanics, and how it translates into less pain and more confidence in the rest of your day. This is Dr. Robert Ellis. If you have ever thought, mornings are my worst enemy, stay with this video. By the end, mornings can become a little less frightening and a little more like a gentle starting line instead of a wall you have to climb over. Let us turn this science into something you can actually do, half asleep, before your feet even touch the floor. Think of this as a 3-step morning routine for back pain after 60, moving from the gentlest wake up on the bed to a little more movement on the edge of the bed or a chair, and finally to standing with more confidence. Step 1, in-bed breathing and gentle. Unstiffening, lowest impact. Mechanism. You wake up, you notice the stiffness, and instead of rolling and jumping out of bed, you pause. Lie on your back if that is comfortable, or on your side if your back prefers it. The first job is not to stretch hard. It is to turn off the panic in your nervous system with slow breathing. Place one hand on your belly and one hand on your chest. Gently breathe in through your nose for a count of 4, feeling your belly rise a little under your hand. Then breathe out slowly through your mouth for a count of 6, like you are gently blowing out a candle. Do this 5 to 10 times at your own pace. The goal is to feel your shoulders drop a little and your body soften into the bed. Next, add very small pelvic tilts. If you are on your back with your knees bent, feet on the mattress, gently flatten your lower back into the bed as you breathe out, and then let it relax back to its natural curve as you breathe in. The movement is small, like rocking a bowl of water without spilling it. You are not forcing a big arch or a big push. You are simply reminding the joints and discs that they can move in a safe, supported way. If you are more comfortable on your side, you can do a similar idea. Gently tuck your tailbone slightly under you as you breathe out. Then let it relax as you breathe in. Again, small and smooth is the rule. Study gentle, controlled movements in a neutral or slightly supported position have been shown to reduce stiffness and help distribute loads in the lumbar spine, especially after prolonged static positions like sleep. Breathe in exercises that encourage relaxed, slower exhalation can also calm the nervous system's stress response, which often amplifies the perception of pain first thing in the morning. Daily life relevance. This first step is like defrosting your spine. Instead of going from frozen to full speed, you are taking 2 or 3 quiet minutes to tell your body, you are safe, you can move, you do not need to brace so hard. Many seniors find that after just a week or 2 of this, the first steps out of bed feel less shocking and more like a gentle transition into the day. Step 2, bed or chair-based mobility. Teaching the spine to glide, not jab, medium impact mechanism. Once your breathing is calmer and your lower back has done a few gentle tilts, you are ready for small, guided movements. If you are still in bed on your back with your knees bent, start with knee rocking. Slowly let both knees fall a few inches to one side, keeping your shoulders relaxed on the bed. Then bring them back to center and go a few inches to the other side. You are not trying to twist far. You are only inviting the spine and hips to share a little motion. Next, try single knee hugs, but in a way that respects your morning vulnerability. Bring one knee up toward your chest, just until you feel a comfortable stretch, not a pull, and hold for 3 to 5 seconds, breathing slowly. Then switch legs. If hugging the knee all the way in feels like too much, simply bring it halfway and stop there. If you prefer to sit on the edge of the bed or in a sturdy chair, you can shift to seated mobility. Sit tall with your feet flat. Place your hands lightly on your thighs. Slowly roll your pelvis forward a little to gently arch your lower back, then backward a little to gently round it. Again, think small wave, not big bend. Follow this with small, seated rotations. Turn your chest a few inches to one side while your pelvis stays facing forward, then to the other side, all within a comfortable range. Study physiotherapists often recommend controlled segmental movements, such as gentle lumbar rotation and pelvic tilting, to reduce morning stiffness and distribute loads across the discs and surrounding tissues. These movements can help break up the stiffness that builds during sleep without placing high bending stress on the spine, which studies show is particularly risky in deep flexion early in the day. Daily life relevance. This step is a rehearsal for the small rotations and bends you will do all day, turning to look for your slippers, reaching for a bedside table, leaning slightly to wash your face. By practicing these motions slowly under control, you teach your spine and muscles how to move without jolting or grabbing. Many seniors report that after adding this step, simple morning tasks like putting on socks or getting dressed feel less like danger zones. Step 3. Activating the morning support team. In sitting and standing, highest impact. Mechanism. Now your spine is warmer and less stiff. It is time to wake up the muscles that will support you when you stand and start walking. Sit at the edge of the bed or in a chair with your feet flat and your hands resting on your thighs. Begin with seated marches. Sit tall. Imagine a string, gently lifting the crown of your head toward the ceiling, and slowly lift one knee a few inches, then lower it and switch sides. Keep your trunk as still as you comfortably can. Avoid leaning way back or collapsing forward. You should feel the front of your hips and your lower belly working a little. Next, practice 1 or 2 gentle sit-to-stands. Scoot to the front of the chair. Place your feet under your knees, lean your chest slightly forward, and push through your feet to stand up. Use your hands on the chair or your thighs if needed. Then slowly sit back down with control. You are not doing a workout set. You are reminding your legs and core how to share the work of getting out of a chair. Finally, when you do stand up for real, pause for a moment with your hands resting lightly on the back of the chair or on a countertop. Gently shift your weight from one foot to the other, feeling your hips and spine adjust. Then take your first few steps slowly, like you are walking through water, not rushing across a busy street. Study research on older adults with low back pain shows that exercises targeting functional movements, such as sit-to-stand and controlled marching, can improve both pain and independence by strengthening the muscles that support the spine during everyday activities. These kinds of movements also help retrain coordination between the trunk and legs, which is often disturbed in people with chronic back pain. Daily life relevance. This step directly translates to what you do outside of a routine. Rising from the toilet, getting out of a car, standing up from the couch, starting a walk. If your body has just practiced these patterns in a gentle, controlled way, the real-life versions put less sudden load on your spine. Over time, this can mean fewer sharp morning zaps, fewer near falls, and more confidence starting your day. How long, how often, and how to adjust if you are very sore. A complete version of this morning routine might take 5 to 10 minutes, 1-2 minutes of breathing and pelvic tilts, 2 to 3 minutes of in-bed or seated mobility, 2-3 minutes of activation in sitting and standing. If you are very sore or very fearful, you can start with just step 1 for a few days, then add step 2, and only later step 3. Nothing in this routine should feel like a test you can pass or fail. It is a conversation with your spine. On bad days, the conversation is shorter and even gentler. On better days, you might linger a little longer in the movements that feel good. Over weeks and months, what often changes is not just the intensity of your pain, but its shape. Instead of a brutal, unpredictable spike every morning, you may notice a mild stiffness that fades more quickly. Instead of feeling like you have to brace for impact getting out of bed, you may feel more in control, as if you and your back are starting the day on the same team. From morning routine to long-term independence. This is where the morning routine becomes bigger than just back pain relief. When you start your day with a few minutes of intentional movement, you are setting a tone for the whole day. You are telling your body that it is meant to move, not just endure. You are telling your nervous system that bending and standing are skills you are practicing, not threats you are hiding from. Over time, a consistent morning routine can support independence in simple but powerful ways. You may feel more willing to go for a walk or run an errand because your back is not screaming from the first step. You may find it easier to dress yourself, stand in the kitchen, or get in and out of the car. These are the building blocks of staying in your own home, doing your own tasks, and staying involved in the lives of the people you care about. The goal is not a perfect, pain-free back. The goal is a back that recovers faster from stiffness, tolerates more of the movements you care about, and scares you less. In the language of medicine, that looks like better function and less disability. In the language of everyday life, it looks like being able to say yes more often than no. You are not too old for a routine. This is not a fitness challenge. This is not about becoming someone who loves exercise or spends hours on a mat. This is about seeing yourself as a person who gives their spine a small, gentle gift each morning. You might be 62 and still working, 75 and retired, or 85 and using a walker. Wherever you are, this routine can be adapted. If you cannot lie flat in bed, you do more in the chair. If getting up and down is hard, you shorten step 3 and lean more on the countertop. The identity here is not gym member, it is caretaker of my own body. Instead of thinking, I have a bad back, so mornings will always be awful, try a different story. I have a sensitive back, so my mornings deserve a little extra care. That shift matters. It turns you from a passive patient into an active partner in your own recovery, without demanding that you become someone you are not. A gentle invitation and close-stopping morning. Back pain after 60 is rarely about one magical stretch. It is about a small, repeatable routine that respects how your spine actually behaves after a night of rest. A few minutes of breathing, gentle motion, and activation can be the difference between a day that feels shrunk by pain and a day that feels more open. If this routine sounds manageable, consider trying just the first step tomorrow morning. See how your back feels when you take those first few steps after breathing and small pelvic tilts instead of rushing straight out of bed. If it feels even a little easier, add the second and third steps over the next week. This is Dr. Robert Ellis. If this video helped you understand your morning back pain and gave you hopeful, practical ideas instead of just more fear, consider liking the video and subscribing to the channel. It helps more people over 50 find simple, realistic ways to move with less pain. You are not too old to change your mornings. You are not too stiff to learn a new routine. You are simply at a point in life where treating the first 10 minutes of your day with care can change the other 14 or 15 hours that follow.